Last thing we have are some digestive tract disorders. There's I think the book gives some stats, or I've seen some stats somewhere. It's like 60 to 70 million Americans suffer from some kind of digestive tract disorder. So all these are fairly common. Some of these are very, benign type of things, or we think as benign type of things, like heartburn, vomiting, diarrhea. But then there's some ones that are a little bit more serious, some diverticulitis, some inflammatory bowel conditions, Crohn's disease. So there's a number of things that are much more severe and serious. Of those 70 million that have them, 13 million require hospitalization. There's some kind of crazy number out there like that. So, these can be really, really serious, especially if you can't get them underneath control, like diarrhea. Diarrhea is, we've all had it. It's no big deal. You've all survived. You're survivors. But if you don't get that massive loss of fluid under control, okay, now it can be a very, very deadly situation, especially for toddlers, okay? So these are things that can be very but can balloon really quickly. First kind of two that we have here, again, these make great multiple choice questions. I don't believe I've asked any essay questions on these ever. So this is where you see them. Gastroesophageal reflux. Heartburn. But gastroesophageal reflux sounds so much more like heinous, like you should get out of work for it. So use that term next time instead of using heartburn. Heartburn, you'll get no love. But what is heartburn? Again, it's that burning sensation in the chest there. Again, kind of where the heart is, hence the name heartburn. What is it though? It's all that acid content from the stomach coming back up into the esophagus, okay? An occasional heartburn or an occasional acid reflux situation, no big deal. But if this is a chronic thing, and chronic happens for a very long period of time, yes, that's vague. That's what chronic is, though. If we get maybe several years, 3 years, 5 years, 10 years of this constant reflux of acid material, then that leads to what's called gastroesophageal reflux disease, GERD. You've probably heard of that one. With GERD, we have damage. We are changing tissue types. We go from one tissue type in that esophagus and it changes into another one. That's not good. GERD is going to be something that makes it more likely for you to develop cancer in that esophagus. So it can result in this thing called what's called Barrett's esophagus. And that's a much more likely outcome is some kind of cancer associated of the esophagus. Okay, so getting that heartburn under control is really paramount. What are some things that can aggravate heartburn? Well, a number of different things. And guys, I'm not going to have every single one. Just, pick a couple. Okay, pick a couple to remember. All right, and if I ask that on an exam as kind of a list here, throw them down. One of the biggest contributors to heartburn is always body fat. Now, how do you get body fat? Well, you get body fat by not exercising, by overeating. Okay, so body fat and overeating, those two go hand in hand. Anything acidic generally is going to aggravate or worsen potential heartburn. So drinking alcohol or coffee are obvious things. Alcohol, it could maybe cause it after drinking a couple of drinks, after drinking 10 drinks. Alcoholics tend to have a lot of heartburn. So obviously an alcoholic would be somebody who drinks a lot of alcohol. So an alcoholic would be somebody who has a higher incidence of, GERD. Drinking coffee is acidic. So again, what's a lot? I don't know. I've never seen a specific study. 2 cups a day is generally considered a perfectly fine amount to consume. Anything above that, and you start going to have some adverse health reactions. Chocolate, okay, peppermint, greasy, spicy foods is pretty obvious. Okay, cocoa powder in chocolate is pretty acidic. The cocoa powder, it helps to relax the esophageal sphincter. And so that'll cause a surge in serotonin sometimes as well. And we get a massive relaxation within that sphincters of the esophageal sphincter there. And you can get a huge rush of gastric contents back into the esophagus there. So eating a lot of chocolate, cocoa powder can cause too much relaxation there. And that's what leads to it, to all that heartburn. I don't expect you to know the rhyme and reason, the physiology behind it. I just like to talk about things because it's pretty interesting. Peppermint has a side effect that helps to soothe the same peppermint, that can help soothe it, because peppermint is something that is also usually suggested to help lessen, to help soothe your heartburn situation. But it can also, in high amounts, can also relax or loosen up that cardiac sphincter, that lower esophageal sphincter. And again, if I don't have a tight close on that lower esophageal sphincter, all that acid content can come on back. So if you consume a lot of peppermint, again, that could be something that's very detrimental to you. Greasy, spicy foods kick up the acid content production within the stomach as it tries to break down those type of foods. It's just difficult for you to do. As you can kind of see, again, tomatoes are pretty acidic. Anything from a tomato can be pretty acidic. As you can kind of see, that's what it has inside of it that causes an increase in production of gastric juice within the stomach. Right? So eating stuff that's acidic in nature, and all of these things are so far, this is how it happens. This is what it's doing to you. And I'm not going to ask you the physiology of it, like I said, but understanding just a little bit as to why, yeah, that's always cool to know. For smoking is really contributes to negative health outcomes with literally everything. It's really fascinating what nicotine, smoking, or secondhand smoke is always related to. It's always a contributing factor to certain disease processes. And you're like, how can really smoking do that? Well, in this case, nicotine helps to really relax that, again, that cardiac sphincter, that lower esophageal sphincter. And it's all about sphincter control. Always. Again, we get all that acid content come back up, and this is a view of the esophagus right here. And this is what normalish tissue looks like. You see this pink coloration here. And here, this is what that damage looked like. As that acid content washes back up through here, it erodes the tissue. It's not designed to buffer that high acid material, right? There we go. What do we have down in the small intestine? We have Brunner's glands within the duodenum. We have all that bicarbonate solution being secreted from the pancreas. Okay, here I don't have that. So we start to erode that way, that esophageal lining there. And if you don't get that GERD under control, that reflux under control, again, it changes the tissue type here, and it doesn't look like it's changed. And for all intents and purposes, you're not going to see that just by looking at this view right here. Okay, there'll be some very obvious changes that occur because you'll eat away the muscle of the esophagus. And so now, instead of peristalsis, moving that food down towards your stomach, all this will be quote unquote dead. And all you got to do is stay standing up and allow gravity to do its work, which can be super duper irritating. What could you do to reduce your risk? Again, grab a couple and hold on to them. Okay? But losing weight, that's a big one. Don't overeat. Again, these things go hand in hand. Don't smoke. Don't lay down immediately after eating. That's a huge one right there. If you do have to lay down and it does cause some issues, keeping that head elevated. One of the most obvious ones, don't wear tight pants, at least around your waist. That just cinches up, that pushes up all those organs in your abdomen up towards your diaphragm. Now, what's it going to compress? That stomach up against it. And that'll open up that little sphincter a little bit more and obviously facilitate acid movement. And then lastly, I mean, knowing what foods. If you know that every time you eat whatever, it gives you heartburn, stay away from it. You can also use baking soda when you have heartburn. Sure, it's a buffer. So yeah, you can take a spoonful of that if you'd like. Again, it's a buffer. Ulcers, if I was to go back to this picture here, if we were to eat away at the lining here and go deeper into the muscular layer and some of those underlying layers there, that would be a ulcer. You can have an esophageal ulcer. You can have a gastric ulcer, peptic ulcer. This is in the stomach. You can have a duodenal ulcer. That's a ulcer within the lining of the duodenum. So there are a number of places where we can have ulcers, where we can have these little erosions, if you will, of the tissue there that makes up the structure. We can have it in the stomach, esophagus, small intestine, specifically the duodenum. So you can have this anywhere. Some of the most common causes for these ulcers are really this thing called Helicobacter pylori, H. pylori. That's the most common cause for ulcers that we have here in the United States. And here's what it looks like. Okay. Do you take a lot of NSAIDs? Okay, that increases the risk for gastric ulcers because you're affecting Helicobacter pylori. Alcoholics, smoking, I talked about those things being associated with everything here. So if you have an overabundance of this bacteria within you, within your stomach, generally that is associated with excess acid reflux, which leads to ulcers of various different structures. Some people have heartburn, some people have ulcers, and it's not due to Helicobacter pylori, even though it's there. It's just not in high numbers, so it's not the specific cause. Some people have high numbers of it, and it is the specific cause. Why is it that some people suffer from it and some people don't? They don't know. This is bacteria that's lived in our stomach for a super long time since we started walking around. So it's unknown why some people suffer from H. pylori infections and some don't. It's pretty interesting when you read all the research. It's kind of all over the damn place. You know it. You've all suffered from it. Constipation. an inability to have a bowel movement, a bunch of different causes, dietary fiber is a major one. Okay. Taking painkillers, opiates, any type of painkiller can cause you to have constipation, gets rid of the pain, but it slows down your digestive tract, and especially that large intestine. Anxiety, depression, there's a lot of different causes, a lot of psychological causes for it as well. Everybody's favorite, hemorrhoids. Hemorrhoids, here we go. Is an inflamed and swollen blood vessel. That's all that is. How do you get that? By sitting on the toilet for too long and pushing really hard because you don't have any fiber, vegetables in your diet. How else can you get it? Well, by standing all day on a hard surface. Ugh. How else? By sitting all day on a hard surface. There are a number of causes. There's supposedly maybe some genetic components to it. But let's look at it from stuff that we know. Straining on the toilet is going to cause it. Here's these blood vessels right here. Okay. Here's where they've become swollen and dilated. And every time that fecal matter comes by here and rubs by it, it opens it up. It's very delicate structures, these capillaries down in here, these blood vessels. And so every time that fecal matter passes over it, why is it painful? Because you're tearing that tissue open every time. And when you look down, you have a lot of blood in your stool. If it's red, you know these hemorrhoids are external hemorrhoids. So these are things that you'll see, and here, boom. Okay. So you'll see these things. If it's black in nature, that just tells you that it is a hemorrhoid that is internal. So it's within the body, and your body is just kind of breaking it down a little bit, that blood. And so it appears black in your stool, black tarry stool is what is associated with that. So again, hemorrhoids, not good. If you've ever had one, it's very painful, very itchy. It is damage to tissue. You've torn it open, it's healing. It's moist down there, obviously. So it has a very difficult time of trying to heal very quickly, considering you have bowel movements regularly, hopefully throughout the day. How would you get rid of them? Surgery, rubber band, basically surgery. You put a rubber band around the blood vessel that causes it to atrophy and goes away. Your body just breaks down the tissue. That would be one way to do it. There's some other ones where they surgically remove them. Very painful. Don't do it. Sitz bath, S-I-T-Z, sitz bath. You just sit in some warm water. Basically, you don't have to sit in it up to your waist at all, just enough to cover your bottom. And that helps to relax the inflamed tissue. And that can help to facilitate some healing and repair. Obviously, suppositories to help, diminish the swelling on the tissue so that so it can heal and repair, and really just eating a lot of fiber. Boy, fantastic conversation to have, right? Let's go out and eat. All right. Diarrhea. Yeah. Frequent, loose, watery bowel movements. Okay. Why is it bad? Because you lose a lot of water and you lose a lot of nutrients, which obviously leads to some malnutrient situations. And if we lose enough water, then we lose a lot of electrolytes, and that can affect the balance and chemistry of the brain. Children, elderly, are very vulnerable and susceptible to these very negative health outcomes that are associated with diarrhea. A lot of different causes, they're all over the place for it. Usually it's something that you consume, or you eat food in an area where you've never been before. Bacteria. The last kind of few we have are associated with this concept of irritable bowel syndrome, IBS. IBS is all over the place. Women, unfortunately, more likely to suffer this than men. Why? We do not know. What are some things that you can potentially do to help lessen your symptoms associated with irritable bowel syndrome? Well, really kind of this one up here. Gluten is a major cause for it. Getting rid of foods that have a lot of gluten in it, wheat, rye products. That is going to be probably the first thing that a physician will tell you to do. Next thing is probably going to tell you to get rid of a lot of nuts as well. Nuts, seeds, sometimes they can get in and get stuck, if you will. They just kind of hang out within the folds of the large intestines. And that can be something that aggravates it in some people as well. Increasing dietary fiber is going to be a thing that kind of helps to facilitate you not to have IBS. High fiber is associated with good, easy bowel movements. And that's really the key when it comes to helping to break that cycle of not being able to go. The difference between irritable bowel syndrome and irritable bowel disease is really this thing right here, where IBS comes and goes willy-nilly. Sometimes it's caused by stress. Sometimes it's caused by, again, gluten, most commonly. Nuts, very common. Irritable bowel disease is an autoimmune. So here we have an immune response, okay? So here we have an immune response, where in the other one, I don't necessarily have that. Something's causing the irritation, and boom, we have irritable bowel. Here, in this case here, again, the cause, a lot of it's unknown, but here with this one, we're having an immune response, okay? Here we're having an immune response. That's the major difference here. This is when you're going to have a much more potentially negative health outcomes, okay? So you're going to have a lot of crazy things here. Diarrhea, not necessarily crazy, but rectal bleeding. Again, it's inflammation. You have inflamed tissue inside the body. It's going to be bleeding. Cramps, massive cramps, some unintentional weight loss. If we have diarrhea, if we have this inability to absorb nutrients, obviously you're going to start losing weight. Okay. So here, and again, fever. What's associated with inflammation? Fever. Okay. So here I have all the components of an inflammatory immune response going on here. When I look at inflammatory bowel disease, we don't necessarily call it IBD. Some people do. But usually we call it Crohn's disease or ulcerative colitis. And I'm sure you've seen the commercial on TV. It's that you see commercials all over the place now, it feels like. Ulcer. Okay, so we have a number of ulcers in the mucosa, in the lining of that colon and rectum. That's going to be really painful to deal with. Again, it's hard to understand the cause for these things. Having a food diary really helps with trying to figure out what is potential triggers for you with this disease. The other one is Crohn's disease. And in Crohn's disease, instead of like an ulcer, we get abscesses. We get these massive, basically pit for disease to just be breeding itself. So in this one, we get massive abscesses within both the small and large intestine. If I'm just affecting the large intestine, that's one thing. But if I'm affecting both the large and small, well, now I'm really interfering with absorption of nutrients, macros, micros, everything here. It's not like ulcerative colitis where I'm just affecting the colon, so I'm just affecting a handful of vitamins and minerals. With Crohn's disease, I'm really affecting everything now. And with these abscesses, they could be to the point where you have to have it, you'll have to have surgery to get rid of these, because an abscess can be very difficult to deal with, super duper painful, more prone for a lot more infections, more inflammation, and this negative cycle of inflammation and destruction of absorptive tissue continues. So you have massive malabsorption going on here with these. That just kind of shows you there's a lot of commonality between the two. There is some separations, right? But for all of them, again, causes unknown, yeah. But I mean, there's no inflammation going on here, or there's no inflammatory response, I guess I should say, immune response. Okay, I get the immune response with irritable bowel disorders, whether it be UC or CD. The last thing I want to mention here, something that has become much more common in the last several years, are these things called diverticuli. And if you remember that picture of the large intestine, in some people, you will see these small little pouches that just kind of hang off the side. If I go back here to my large intestine pic, you'll see these little pouches that kind of bulge off the side here. Okay, yeah, you'll just see them. Usually you see them in the descending colon, and the sigmoid colon is generally where you see them. Okay, you can get them all over, but you tend to see them down on this side. There are some individuals who have them across the transverse and the ascending colon. Obviously, that's no fun at all. But with these little pouches that hang off the large intestine there, it just makes it weak. You can get seeds stuck in there, nuts stuck in there. This will agitate and irritate the hell out of this large intestine. And that can lead to a lot of that IBS that we talked about just a few seconds ago. You all have them. You all have them to a varying degree. Some of you have a lot, some of you have a little, some of you have them and it doesn't do a damn thing to you. Some of you have some, and boy, it screws you up. Sometimes those things can bleed. That would be diverticulitis. Itis means inflammation of. Okay. Diverticulitis, itis always means inflammation. Diverticuli, obviously, an inflammation of those pouches. When you have this, you can see a lot of bleeding with these individuals. Okay. And this is not an immune response at all, but this is just inflamed tissue because something's gotten stuck in there. Seeds, nuts, that's generally what you see trapped. Which is to not confuse, and it's not similar to, and I'm not going to ask this on the exam, but it's not similar to like an old person having a lot of fecal matter within their large intestine. That's due to just an inability for that thing to be motile, not moving around. So that's their issue at that point. As you get older, the motility of your digestive tract obviously slows down quite a bit. And so that's why you see that in those older individuals. Okay.